Dr. Chol came here from sunny San Diego, California. We are getting started because we have a pilot all the way from Florida, and he's got just nagging back pain, and he's tried everything. And unfortunately, we've decided to proceed with surgery, but luckily we have the most minimally invasive technique available, ultra minimally invasive LES, laser endoscopic spine surgery, which you have to admit is a very cool name for a minimally invasive procedure. But check out these images. It doesn't look like much, but it's a big deal. Here are the two disc protrusions, and the key is that there are annular tears there, and even though most annular tears are asymptomatic, that is not the same thing as saying all annular tears are asymptomatic, because if you're this patient, it's 100% for you, because we know it's symptomatic by doing targeted injections with both an anesthetic and a steroid, and he got markedly better. But unfortunately, the pain came right back after the anesthetic wore off. So I'm going to go in here, make a little poke hole, sneak into the canal, get to the disc, and treat all these annular tears. At the same time, we will release all the nerves here because they are completely stuck down due to chronic inflammation, and then start a new healing reaction. And hopefully this time it will go down the path of healing with the rise of the inflammatory process, and then it should just turn off after a week. Instead, on him, it just stayed on. That's my hypothesis. So that's what we're treating. It's like tendonitis surgery, but in the back. So wish me luck, because I want to fly privately one of these days. Shut and save. Oh, it's already leaking out. Shut and save. Yep, shut and save. Shut and save. Oh, it's totally in. Shut and save. This is barely though. Look at that. That disc is just shambles. Shut and save. Blood vessels, nerves, and like my mama always said, spine surgery would be so much easier without blood vessels and nerves. Look how cool. There's the L disc. And that's why I use the blue dye, because I'm like a professional athlete. If you don't cheat a little bit, you ain't trying hard enough. Look at all these adhesions. This should just literally just float away. Should be as slick as a foosball table, but no, look at all these adhesions because of inflammation. Sort of like having a piece of tape on your neck. As you move your neck around, the skin underneath the tape is going to get very irritated. Now imagine that tape is your nerve. Look at that granulation tissue right there, all that redness. Right there. Next thing I'm going to do is look for the empty tent sign. Right there. Right there. I just got to rotate the nerves over and out of the way. This is the hardest part number 2. Hardest part number 1 is just getting everything organized. But luckily, I have the A team helping me. Oh, there's a lot of loose disc here. I'm being very gentle. I don't know if you can see, but I kind of release it as I pull up. I just manhandle this thing. I'm feeling for loose flaps that I'm teasing out. There's a lot. Oh, yeah. Look at that flap. It's sort of like finally getting that pimple to pop. It's an odd satisfaction in it. Look at that. It's a punk piece right here. Thank you, that makes sense. Okay, this is 4-5. A lot of work, lots of badness, but all gone. So this cavity had all these loose, torn up fragments. There's a little bit over on the lateral side probably, superficially. The dural tube is intact. Look how pissed off it looks. It's supposed to be white, almost gray. And you guys tell me if you think it seems less adherent. Are you guys seeing what I'm doing? Can you see that? That's the nerve right there. What a difference, huh? And it's real, it just falls in. Okay, this disc does not have an empty tent sign. It just has lots of adhesions. So this is one I think we should just treat the surface. It's called an annuloplasty, but we should not do the discectomy because it's an added trauma that I don't think you need. And there's some of the granulation tissue. Look at that, how it's adherent right there. That's good news. Let's go on and on about a dural tube that looks really inflamed and injected. And this is the first one in a long time that doesn't look that bad. And if you compare this level with the level that I just did, it's night and day. Surgery all done. A vampire with really weird teeth bit into you. The surgery went beautifully, and we're all expecting a great result, and we're praying for a speedy recovery. So, best wishes, right, guys? Yay!